Welcome to Stress-Free IEP. You do not need to do it all alone. With your host, Frances Schefter, Principal of Schefter Law. You can get more details and catch prior episodes at www.schefterlaw.com. The Stress-Free IEP video podcast is also posted on YouTube and LinkedIn, and you can listen to episodes through Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more. Now, here's the host of Stress-Free IEP, Frances Schefter.
Hello, everyone, and welcome to our show. Today's special guest is Alicia Dalton, who is the Director of Outreach and Strategic Partnerships with QCI Behavioral Health. She has over 30 years of experience in the behavioral health field. Alicia has worked extensively across various health departments and clinics, bringing a wealth of knowledge and expertise. Her passion is connecting patients with the services they need and especially enjoys working with the underserved. QCI Behavioral Health is an outpatient mental health clinic serving multiple locations, including Largo in PG County, White Plains covering Charles, Calvert, and St. Mary's County, and Hagerstown. Alicia is going to share her insights about the important services that QCI provides for our community and the impact they have in supporting mental wellness in these communities. Alicia, welcome to the show.
Oh, thank you for having me. I'm super excited to be able to share our services.
So tell me a little bit, give us a little bit of an overview of QCI Behavioral Health and its mission.
So QCI Behavioral Health has been in existence for just about 30 years now. I've been affiliated with QCI for over 15 years at this point. And we have outpatient mental health clinics. And one of the things that I always share that we do well is our mobile treatment services. And our mobile treatment services exist of a multidisciplinary team of individuals that work together to provide mental health services to individuals who are suffering with severe mental illness. And we do that in the community. Our mission is to provide services in the community where it's most comfortable for those individuals to receive nursing services, therapeutic services, community support specialist services, and also we have nurse practitioners on our team as well as psychiatrists, and we provide transportation for our clients to come in to see those prescribers.
Wow, that is awesome, because I know one of the issues is transportation, is being able to get to service providers, especially in our underserved communities. So is it on a emergency basis, on a scheduled appointment type basis? What does that look like?
Yeah, so what I like to explain is we're not a crisis facility. So you do need to have an appointment, and we have an admission process. That process is twofold, where a person will come in to see the psychiatrist and the therapist. And once those two individuals see the patient, we determine what level of care is best for them, whether it be outpatient, medication management, mobile treatment services. In our Prince George's County office, we also have a homeless program where we actually go into the community and seek out individuals who are housing insecure, and we engage them into our services. And once they are admitted to our clinic, we help them find housing in the community. We also help with connecting them to the services that they need, the benefits that they're entitled to in terms of cash assistance, helping them with their SOAR application, fast tracking, getting their disability application completed. We also help them connect with WIC or clothing closets if there's food insecurities. We look at all of those things, and we do a very person-centered approach. So our treatment plans are very individual. They're not cookie cutter. They're very individual for what that person needs at the time.
So full wraparound services, basically,
Yes.
It sounds like. And is it through insurance, or is it a nonprofit? Like, how do you guys private pay? What does that look like?
So the majority of our patients have Medicaid, Medicare, or uninsured. We do see individuals who have private insurance, but I always explain that if someone is eligible for mobile treatment services, private insurances don't pay for that. So what we do is go to the state and ask for an authorization to provide those services for that patient.
Oh, so they don't have to do like submit the super bill to their insurance company later or anything like
No.
that?
Mm-mm.
Wow, that's great.
No.
And I mean,
Yeah.
does the state usually approve it
Yeah. Typically
and
they
say at least
will,
for
if we can
now?
make it clinically, yeah, if it's clinically justifiable, we definitely do what we can to get those individuals in that service because mobile treatment service is a very high intensive level of care. And I explain it as it's the highest level of care that a person gets before they need to go to the hospital. So that's one of the things we try to prevent is the overuse of ER, using ER as your primary care or urgent care, right? So we get our patients stable so that they don't feel that they need to go to the emergency room to get care. They can get that care here, and we prevent overuse of ER visits.
And is it just for the mental health or is it for all medical?
So mobile treatment services is for individuals who have severe mental illness, which is we call SMI. That's individuals who will qualify for that service. In our regular outpatient program, those individuals come in to see their therapist or their psychiatrist as needed. Mobile treatment is a more intensified care where someone on that team is seeing that patient at least once or twice a week.
Understood. And it's scheduled appointments and so forth.
Yes, it's scheduled. We're not a crisis facility. However, we do have a relationship with 988. So if a person needs a quick appointment, they're almost in crisis, we can typically get those individuals in same day, next day.
988, I haven't heard that term before. What is
Oh,
988?
I love that you asked that. So 988 is a national program where anyone who's in crisis anywhere in the nation can call 988 and they get connected to the services they need.
Wow.
So it could be, and it doesn't have to be a mental health crisis. It could be, I just need to talk to someone, and they can call 988, and that counselor on the phone can give them suggestions on resources in their community. And the way it's set up, so if anyone calls 988, they're dispatched to a local 988 provider. And then those individuals and counselors refer out as needed.
That is really good to
Whether it's
know.
housing, it's substance use, any of the things. It doesn't have to be mental health.
Does it would 988 work for like a parent that's having a crisis with a child?
Absolutely. It's a phenomenal resource for that.
Wow, I wish I had known about that sooner. It's a lot of my work I do, in abuse and neglect system and fostering and stuff. There's a lot of times we have crisis that as foster parents, we don't always know. And as attorneys, we don't always know what to do.
Mm-hmm.
And having that resource to be able to refer people to or call on behalf of our clients.
Yeah, it's just a cry for help. 988 is 24 hours a day, 7 days a week. And those individuals are trained to refer to resources that they need in the community. It's an awesome resource. And you're right, we need to do more about getting the word out there because I say 988 like
it's nothing.
Yeah. So I'm glad to be able to share that. And if you offline need to be connected to someone on that team in our area, I'm happy to do that.
That is awesome. Thank you. No, I will definitely, maybe I'll have them next on the guest on the show.
Oh, that's actually good. Yeah.
Yeah, to get it out there. Because I mean,
Yep.
that's something I know, as a parent, as a community member, as, anything, knowing where to call and having that resource is so huge and is just a peace of mind.
Yes.
It's
Yes.
just like, I know for me, like knowing there's poison control, if my kid gets into something, I've got somebody to call, right?
Yes. Yes.
Like, so knowing, it just, and knowing that place, like that's part of the reason that Stress-Free IEP, the show came about, is to teach families what's out there, what resources are available. So that is awesome to share that out with our community that, hey, there is a resource, because I know darn well when you're in a crisis with your child, with yourself, with any situation, you don't know where to turn, and going to ER might not be realistic, or, and being able to have somebody to call, that is wonderful.
Yeah.
So going back to you guys at QCI, are you a nonprofit? Are you a state funded? Like, how is your organization?
Yeah, we are for profit. So we see individuals with Medicare, Medicaid, those who are uninsured, and individuals who have private insurance. And if a person wants to self-pay, we can do that on a sliding fee scale.
Got it. Great. That is good to know. And what are some of successes? You've been there 15 years. Like, what are some success stories that you've seen and heard? That's happened?
Gosh. I have a few favorites, but One of my favorites is earlier in my career here, I would be the person that processes the referrals that come in. And for about a month or two, I kept seeing referrals coming from the same person. I'm like, so anyone can generate a referral. It could be clergy, a hospital, anyone, self-referral. But this particular referrals kept coming in with the same name. And I'll just say Anthony. Anthony referred this person. Anthony referred, like, it had to be like 20 referrals.
Okay.
And I looked a little closer, and Anthony was one of our patients. So he was in the community generating referrals for us because we had helped him so much. It was a way that he felt he needed to give back. And it was just so hard. I mean, he did the referral form better than some physicians. I mean, he completed the referral form. So I said, Anthony, what are you doing? He said, I'm just trying to help. You guys have helped me so much. I just want to give back. And so ultimately, that person ended up being on our advisory board, helping to, streamline some of our services. When we have our advisory board meetings, I say, listen, I want to hear everything we do well, but I want to hear the things that we can improve on too. And so I asked him to come in as an advisor, and he did. So that's one of my favorite ones. Yeah. Another one would be, I always talk about how intensified mobile treatment services is. And so a lot of people may not know this, but if you live in Maryland and you're homeless, you can pitch a tent in any regional park in Maryland for 2 weeks at a time without being ticketed. So I didn't know that until we had a patient living in Watkins Park. Okay. So our nurse had to go into the woods, find the patient, and give them their injection for the month.
Wow.
So that's how intensified mobile treatment services could be. When it was the therapist's turn, the therapist had to go in Watkins Park and find that pitch tent and provide therapy services for that patient. So we do as much as we can to get individuals engaged, and we get creative sometimes about how we see our patients. One patient just wanted to be seen at the 7-Eleven. Okay, we'll meet you in the parking lot. That as long as it's a private, it's confidential area that you can meet them. So, if it's in the car, that's what we'll do. We'll do anything to make sure that they stay connected to treatment.
That's wonderful. And I'm assuming the injection was voluntary, like the client wanted the injections.
Yes. So a lot of our patients in that program are on long-acting injectables, which keeps them more compliant with their medication. And it helps them, become more stable. They can get that job and keep the job, right? They can have the visits with their children and increase those, visits with their children. And ultimately, you have that family reunification, that person that can keep their job and not, lose it because they are off their medications and they can't get to work on time. So all of our services are definitely voluntary. We don't force anyone to participate in our treatment services. The only time someone is mandated if they come through mental health court, who we have a good relationship with. And so some of our patients come through that program because we don't want them to be incarcerated because all they need is our services. And so a lot of the judges will allow them to come to QCI, stabilize their services to prevent them from going into the prison system.
Yeah, that's such a huge thing. All the work I do with DC Superior Court and the abuse and neglect system, it's sad because a lot of the families, the issue is mental health. And they can't get the services because DC, there just aren't services to be had. There aren't providers. And it causes such, just everything, families torn apart and everything.
Yeah.
But you guys don't do DC, do you?
We're working on it.
Oh, good.
Working on it, and I cannot wait. I've been working on that for a while, and it's really coming toward the surface now. We're going to want to provide services to individuals who live in the district, but also we're working on being paneled with TRICARE so we can see more veterans as well.
Oh, that's great. Yeah, because that's part of the issue is that there isn't the mental health services that are available out there.
Yeah.
And so sometimes, people might want the mental health services, but might not know how to get them, in other areas we have the luxury of being able to sit on the phone for 3 hours calling providers, and self-pay if we have to. And that's not
Yeah.
always a luxury that people have.
Yeah, that's true.
So providing that service is so needed. So needed. Like I see,
Yeah,
I can tell you the stories I hear and I see, but I'm sure we could swap war stories. But it's so great. It's great to know that you are working on DC. But so right now you only serve Prince George's, Charles Calvert, St. Mary's, and Hagerstown?
Yeah, which is Washington County.
Washington County. So is it all of Washington County, or is it just like Hagerstown?
No, anyone in Washington County could be serviced in our Hagerstown office.
Got it. Okay. So Charles County, Calvert County, St. Mary's County, Washington County, and Prince George's County, and working on DC. Are there any other areas you're working on?
Let's just get through DC.
Okay. I'm just asking. I know. No, I know. It's a lot. It's a lot.
It's hard. Yeah. No, DC would be our next focus for sure.
Got it. So, no, that's good to know, because obviously reach out if you need help with connections or anything. So I don't know, like, so you said anybody can refer. So I'm assuming like it doesn't matter if you live in Hagerstown as long as the patient lives in Hagerstown, right?
Yes.
In Washington County. Okay.
Yes. Yeah,
So
because
like,
that's where their Medicaid follows them. Because again, we see the majority Medicaid, Medicare, uninsured. So you have to follow where your Medicaid goes. So if a person shows up here with DC Medicaid, I would have to refer them out to one of the core service agencies in DC.
Got it. So the course, the wraparound services. We hear core services agencies a lot, but it's, in the legal system, but it's hard because again, there's not enough providers.
Yeah.
And I don't know. And, unfortunately, since COVID, there's a lot more awareness of mental health issues. And so I know there's much more of a demand.
Yeah, for sure. Yeah.
What we can
huge demand, but not enough providers.
Yep, exactly. Exactly. And it's, what's the solution? If we knew, we'd all be millionaires, right?
Yes.
But I mean, at least there's something out there. Like, I'd love to know that there's 988 that's nationwide. That is such a huge thing. I know that's going to help a lot of people. Hopefully a lot of my listeners writing it down, sharing it. I know I'm going to put it out on my social media posts all over the place.
I'm a huge 988 cheerleader. I love that group.
Yeah, no, it's great. Is it federally funded, or is it a nonprofit, or what are they?
It's a national program that the way I understand it is different entities can contract with 988 to do that service. So say, for instance, if QCI wants to work with 988, we would contract with them to set up that 24-hour a day, 7-day a week call center situation. And we would, our phones would be linked to the 988 system. So agencies throughout the country support 988 by taking those calls.
Understood. And then you have the list of where to refer them and stuff. Oh, interesting. That is great. Because then it's the providers that are there in it knowing how to do it. That's so wonderful.
Yeah. They know their own community. That's what makes it so great, because they know their own community. Like, I couldn't answer a 988 call for California because I don't know the resources,
Right. And it's not something like, yes, I guess technically you could look it up on, they could have a database of some sort, but it's just nice to have your finger on the pulse of your own community. That's what makes it so beautiful, because I know who I would call in Prince George's County all day long. You know? And you probably know who, like, oh, that person is full. I know isn't taking new patients, but I know this new person is, or,
all the things.
That makes sense. Yeah, that makes a lot of sense, because, as I said, finding providers, it's a challenge.
Yeah.
And knowing who to call. So do you directly connect them? Like, does 988 directly connect them to the people, or they just give them the information to connect?
No, they directly.
Okay.
Yeah, it's a warm handoff. It's not just a referral.
Got it. Handoff. That is wonderful. So I want to hear more. So QCI, anybody can do referrals. We have a couple of counties. And service, like, it sounds like you provide it, but it's not all only mental health services, you said, right?
So we have, we are a mental health clinic. A person has to have a primary diagnosis, mental health diagnosis to come here.
Okay.
Sometimes someone has a secondary diagnosis of substance use, and we can refer them out to one of our community partners if they need help in that area. But QCI provides individual therapy, group therapy, medication management. Is, like I said, we do just injectables for individuals. If that's all they want is injectable, but they don't want the therapy, that would be in our medication management program. And again, we do in the homeless program is only in our Prince George's office. So we don't have that program in our other two offices.
Got it. Interesting. So for referrals, I'm just thinking of, people like, so is basically anyone with a mental health crisis would be referrals to you guys.
Diagnosis. Crisis, we would call
Diagnosis.
988.
Got it. Okay.
So our referral form is on our website. So anyone can go there, click appointment. The referral form will come up. It can be completed. Someone can hand deliver it, fax it, email it, whatever is convenient for them. And then once our administrative team receives that triggers them to initiate that first appointment. And so our admin team will call that person and say, hey, you were referred by so-and-so. We want to set you up for an appointment. And then that's how it starts.
Okay. So then referrals aren't anonymous, it sounds like, which is fine, I guess. But I guess, like, I'm just thinking along the lines
it
of,
could be
like,
anonymous. It doesn't have to have a person attached to it. Like I said, It could be considered a self-referral at that point.
But like, if I knew somebody was in mental health crisis and needed help,
Mm-hmm.
I could do a referral and ask that my name is not used.
Oh, of course. Yep.
Got it.
Mm-hmm.
Okay.
Mm-hmm.
So
the only caveat would be they may feel blindsided by getting a call.
Yeah.
So that's just something to consider.
Understood. Obviously, it makes more sense to, like, hey, I'm thinking about doing this referral. Are you open to it? Because we don't want to waste everybody's time, because if they're not open to it, then, we just wasted services.
Yes. And then, when I used to process referrals, they would say, now who referred me?
Right.
I don't remember anyone refer, that kind of thing. So then that kind of just shuts down the person and they don't want to engage. So.
Right. And they probably don't want to engage with that person anymore either.
Yeah.
Because they kind of like, what did you do to me? Who did you?
Yeah. Yeah.
And a lot of people, with mental health, unfortunately, it's, there's a lot of mistrust or not trusting, paranoia, all of that, which is understandable.
Absolutely. Yeah.
Because you don't know, what are these people trying to do? What are they, but it's such a, I don't even know how to put it. It just, mental health awareness is just so, I don't think people realize how common it is in the sense of how many people have mental health diagnoses and illnesses and are functioning fine in the community because they have those services and they're lucky enough to have those. And, living in the areas that they can get those services versus, people that don't have that capability. I don't know. So,
yeah.
So I know, like, I believe you said you're a regional behavioral health provider, right?
And so each office refers, for that county.
Okay. So how is it different from, like, any other, like, mental health facility that people might call or?
Well, I mean, we are an OMHC, which is an outpatient mental health clinic. And there's others that are, PRP, which is psychiatric rehabilitation clinic, which is a different level of care. So each agency has their own licensure.
Got it. So then I'm just trying to think of listeners of, like, trying to give them a clear when they should, like, what's the best referral, I guess, or I don't want to say the best referral because no referrals are good in that sense, but, like, what should listeners be looking for or listening for or to know, like, you know what, maybe I need to refer them out to OCI?
I would say the safest way is if someone has any inkling that a person needs services, just refer them. Let them get that initial intake and let the professionals, sit with them for an hour and do that biopsychosocial and see what, services they need.
Got it. And is that that first appointment, is that, is there a charge for that, or is it like a free consult? What does that look like?
The insurance pays for it.
Got it.
Mm-hmm.
So,
yeah,
okay.
The insurance will pay for it.
And you serve all ages, or is there we just lost your video. But we can still hear you. Is there like an age limit or like a youngest that you serve?
Our youngest, I don't know what happened to my video. The youngest is 7. Here we go.
Okay.
7 years old up until, I always say 99,
There you go. So if you hit 100, you're doing okay. Right?
Exactly.
Yes. So 7 is the youngest,
Mm-hmm.
but can get the services. That's so great. I'm trying to think what questions did I not ask you that you wish I had asked you?
Well, I can say that, our hours are Monday through Friday. We have, traditional business hours, but we do have an on-call staff. So it rotates. So if any of our patients need to speak with their provider after hours, they can call and still be connected with them, which is a great service.
Got it.
And so that person will just triage and say, okay, it sounds like you may want to come in. Let's see if we can get you an appointment tomorrow. Or no, it sounds like you need to go to the ER, and they will help facilitate that, even if it's in the middle of the night. So that's one thing that I always like to say. We do a lot of community events. We collaborate with other stakeholders in the community because now more than ever, I think collaboration is very important. And that's the way we can make our collective impact. And it's my goal to be a part of that collective impact in the counties that we serve. I want QCI to be the premier name in the community to say, oh, you need mental health services? You need to go check out QCI.
Yeah, QCI is where you want to go. Which makes sense. I mean, and that's what it's all about. And it's knowing that I love hearing that you are client-centered because so many places are like rubber stamp, like, oh, you need therapy 1 time a week, and you see that the psychiatrist for medication management every 3 months, and boom, 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 that's it. And there might be more. There might be other services that are needed.
I have to say that, we were definitely client-centered before it was a thing. Before we were accredited by CARF, we were doing this work, and we always made sure that it was very individualized, because you have to be able to meet the person where they need, what and also they need to be included in their treatment plan. What are your goals and objectives? We don't make up the goals and objectives for them. It's an active communication. It's an active relationship, so that person can buy into the services and be willing to really participate and not feel like it's, a chore to come to services. It's something that they really want to participate in.
Right. Or I have to stay in a shelter in order to get services, or I have to have a job in order, like all of those other
all the mandates. Yeah.
They're right. It's not. And I guess the insurance company is fine because it goes through you. So they make it work.
Yeah.
They don't have, so many insurance companies have restrictions as well, but as we know.
We try to make it, comfortable for our patients to come in. I'll tell you a funny story. There was a patient that came in one time and they were hungry. And I said, oh, well, let's see what we have in our refrigerator. So I found a nicely made salad from Wegmans, and I gave it to the patient, and it was one of our nurses. It was her lunch.
Oh no.
I was like, sorry, Kathy, I owe you lunch. Okay. So from that day, I started a pantry here. There you go. We have our own little pantry now. And so, sometimes people donate items for the pantry. Some staff brings things in for the pantry. And so we'll give our patients a bag and they can go in and shop in our little pantry,
Oh, cute.
So I was like, I think we need that. That's a gap we need to fill. So I can't keep
There you
stealing
go.
my, coworkers' lunch.
Right. That's great. So pantry, do you have like clothing and all that stuff as well? Or do you work
Very
with
minimal
agencies?
clothing, but we do
Okay.
have some, but we have some really amazing community partners that provide services for our patients, which would be like Shabbat Ministries. They provide food. There's a new organization that I'd love to shout out. It's the She Suite. They provide, it's a luxury pantry. So a person can come in and get, once they participate in, whatever the thing is, they can walk away with a Louis Vuitton purse, and diapers
Wow.
for their baby, So I love working with them as well, because they not only provide those services, but they help with employment, they help with resume building, all of those things. So I love partnering with agencies like that because, again, wraparound services, collaboration, that's what gives us our collective impact.
Yeah. And it's, what goes in my head originally is like you bribing them to do services. But you know what? I don't look at it as bribing. It's an incentive.
Yes.
Because
it's incentivized for sure.
Because to me, I'm looking at people are, who is this and what are they trying to, why are they trying to get me in? What are they trying to do to me? What are, do I trust them? Whereas like, okay, wait a minute, I can get a package of diapers for my baby that I really need. So let me go check it out, like it just, it builds a little trust, starts building that relationship.
Yeah, they have like enrichment services, so it's like a computer class or a leadership class, whatever they feel, they need in their life, and they can participate in those classes and then walk away with one of those luxury items. But the food and the clothes, all the other things they can come in and get by appointment. I think they have walk-in Wednesdays too. So I'm happy to share out that resource if you want to add it to your notes.
Yeah, we'll definitely add it to this is live, but then when we do the full posting of it, like we'll have all the show notes and stuff. So if people, our listeners are like, oh, this sounds like such a great service, like how do they get in touch with you? What's the best way to refer? Or if they want to get involved in some way, what's the best way?
Sure. I would say that they can definitely go to our website, which is www.qcihealth.com. They can definitely email me. My email address is Dalton, DALTON, the number 2 at QCIhealth.com. And our phone number is 301-636-6504. So any of those ways, they can reach out to us. And if they have questions that maybe they didn't get answered here on this podcast, I'm happy to answer anything they want to know.
That is great. Thank you so much. And thank you for coming on and sharing all of your wealth of information with our listeners.
Of course. It was a pleasure. And thank you so much for having me.
You've been listening to Stress-Free IEP with your host, Frances Schefter. Remember, you do not need to do it all alone. You can reach Frances through schefterlaw.com, where prior episodes are also posted. Thank you for your positive reviews, comments, and sharing the show with others through YouTube, LinkedIn, Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more.